Hi, good afternoon, Dr. Mahdi. Thank you very much for having us today. As you know, my name is Dr. Naderkhani. I'm the president of St. Nicholas University. We have a meeting with our students tomorrow morning, and there's a number of students who are somewhat anxious or worried about the process of graduating from our school and then getting their license and practicing in Canada. Since you are one of our clinical professors and they're going to be doing a rotation with you, I wanted to spend a few minutes with you and maybe share your experience as an international graduate who is now a very successful vet practicing in Canada. I think that will be very reassuring to hear your words for our students. So why don't we start by having you introduce yourself to us?
My name is Mahdi Botyari. I'm a veterinarian, graduated from vet school in Iran, and then I came to Canada and then start writing my board exam for Canadian Veterinary Medical Association. After a few years, I passed all the exam and start working with several clinics in Canada. Then I start my own business, and then in a few years I have my own clinic. So, the process of getting the license coming for any foreign graduate is pretty standard in Canada. You have to write the board exam, which is consists of the basic science exam, and then after the basic science, you will be able to register and get your spot for the NAVLI exam, which is another writing exam. After that, we will go for the clinical proficiency exam, which is has few parts, including the surgery, which is the spay of the dog, and including anesthesia, which is anesthetizing the same dog that being spay at the same day with another partner, and pathology, which is the consists of some small necropsy, and X-ray that you can do a couple of standard X-ray, which takes 2 minutes, and then large animal practice, and then farm animal like goat and sheep. These are all about 2 or 3 days of the exam in the center that they're taking the exam in Canada or US. That's both in the CPE or clinical proficiency exam.
Excellent. Thank you. So let's break this down for students. So the first exam that you had to write, what was the name of that examination?
The first exam was basic science. That will be very basic test of your knowledge about the anatomy, about the histology, microbiology, or those area of the science. And that is the first exam you have.
Perfect. Do you remember roughly, was it multiple choice? How many questions? One day, multiple days?
It was, yes, the basic science, it took about 3 or 4 hours, multiple choice exam. And yeah, and you have to register for that. And usually lots of examiners will pass at the first or second attempt. They will pass it, yeah.
Excellent. So that's what I've heard as well, but it's nice to hear it from a vet. But what I've heard as well is it's a very straightforward exam. They just want to make sure you actually went to veterinary school. Excellent. So what sources did you use to study?
At that time, there was a lot of source that we would get from the people that would take the exam. I would say you have to be updated for whoever taking the exam. You have to connect them.
Yes.
That's very important to have a connection with all the candidate that taking the exam. I'm not very updated right now. At that time, we had a few books about the basic science like anatomy. I had to review the histology, microbiology, plus the Canadian Veterinary Medical Association will give you the source for all of the exam and some example of the questions also, and they'll give you the source that to study. Example, tell you how many percentage of a small animal, how many percentage of large animal, how many percent of microbiology, and they give you the source. If you go to the website, they're all updated and they give you really good guidance about the where to study.
Perfect. So, well, what we actually do, we have an online library which is available to our students with all those sources. Also, in our class examination, we use those sample questions that they've provided. So our students can be reassured that if they're doing well in their classes right now and they're passing, they're at the level that they need to be. So that's excellent. So after you completed that basic science exam, the second step was
writing the NAVLI exam, which is a little bit more lengthy exam compared with the basic science, and we'll check your mainly case study, meaning they'll give you a example of the patient that you have to manage. That patient basically is a multiple choice exam, and it takes about 7 hours. So they divide into 2 or 3 sections and 2 breaks in between, and it's multiple choice again. But the length of the questions are like lengthy question that you read the case and then you decide how to manage it and the treatment options. And that again, about, I guess I remember it was 6 or 7 hours of the exam with about, I guess, 350 questions, something like that. Yeah.
excellent. Now, NAVLI is only available twice a year for students to write. What do you recommend as far as dedicated time needed to study for this exam?
So for exam, I mean, NAVLI obviously is much more difficult compared with the basic science. But first of all, you have to have a good schedule for registration. So as soon as you pass one exam, make sure you can register for the next exam and find your spot and reserve your spot for the next exam. And then as soon as you find your exam for the next 6 months, you have to study, write the sources and everything. But the main thing is you have to be always on top of the finding the spot and registration, meaning you need to know when you're passing the exam, and then after you notice it, quickly register for your next exam. So with this way, then you won't lose any time, and then you can do it as fast as possible. So I know recently you can do some of the exam not in Canada. You can write it out of the country. Yes. So you don't need to, for example, come to Canada to write the NAVLI and stay in the Caribbean or any other country and register for your exam.
Excellent. Yes, it's available in Jamaica, and we're trying to see if we can also make it available in Dominica, so our students don't have to travel.
That would be great. Yeah.
And every other Friday, we do have NAVLI review session for the students.
Nice.
So we've prepared them from day one for this process, and I think this will help them.
Yeah, definitely. This is really best. As I didn't have this chance to go for the review.
Right.
Even when we were a student in the college, we didn't know anything about the NAVLI, so we were totally blank. For the totally blank, I mean, it takes 3 years or latest 4 years. If you're and you know everything, all the sources, you can finish as fast as 2 years, the whole exam.
Yes. All right. And then finally, after that, the last exam you had to do was the clinical proficiency. Can you tell us a little bit about that?
Yeah, clinical proficiency consists of the few parts. One is the surgery, which is the spay of dog. Usually they bring a standard size of dog, like 15 kg, 10 to 15 kg dog to spay. And then second partner will do anesthesia of the same dog for you. And then in the afternoon, you do the surgery and the partner will do anesthesia. So you switch together in the morning and evening. And the other part is the examination of the large animal, like a cow. And then the other part is examination of the goat or sheep, and then there's a radiology section that you have to take a couple of x-rays, and then necropsy, which you have to do the necropsy of a cat, which you need to know what's the organs, and that's the main part of the, and then one is a lab that you have to do the basic part of the lab skills that showing how to make samples or slides or those kind of things. But the main part is the surgery and anesthesia, and I would say small animal internal medicine. These are the main part.
Excellent. That's wonderful. And also the detail of this exam is also available online, so they can read more about it. And just so, just to say a little bit about our school, even from the fifth semester, in their clinical and surgical skills, our students will start to do their first space. So nowhere in North America or the Caribbean will the students have that kind of hands-on experience. So we've done really everything and beyond everything for these students to be ready to exactly write these exams and be practice ready.
That's excellent. Yeah.
All right. So the students are still, our most senior students are in their fifth semester, but in 2 semesters, they're looking forward to coming to Canada to do their rotation. And I know that your clinic is one of the approved sites. What would you recommend to students who are switching from their basic sciences to clinical sciences? What kind of student do you look for?
First of all, they need to be really enthusiastic about the veterinary medicine, and they have to be really, passionate about the job they are doing. They have to be, very interested to what they are doing, first of all, and then we want them somewhere is very hardworking, and they have to be on time to work and be very on a schedule that show, to us that they're really interested. Obviously, we would love to have the, students here to train them in the hospital that we have internal medicine. We do surgery, we do some lab work, we do dentistry, x-ray and imaging, ultrasound, everything will happen here. Pretty much they can see everything in the hospital, if they're really interested and they're very showing that they're hard work. Definitely we'll be happy to help them.
Excellent. That's wonderful. Thank you very much, Dr. Mahdi. And then finally, just to give them something to look forward to, can you tell us a little bit about your quality of life, your private life? Are you happy with the decision you made? Are you happy as an international graduate practicing in Canada? How is life here for a vet?
I mean, fortunately, veterinarian is a very high demand job in Canada. Right now, we have a very big shortage of the veterinarian in Canada. So they try to find from the foreign graduate mainly because Canada doesn't have enough veterinary graduate. So lots of graduates from the India, Iran, Middle East, and Asia or Caribbean, they come to fill the spot that we really needed. Right now, we have a shortage. Right now, in my clinic, I'm looking for the locum doctor that I don't have it. So I'm going to go to vacation, but I can't find any way to work for me. So they're all booked. Some of them are booked for past 2 years, for the next 2 years, sorry. And then we can't even find a veterinarian. So this is the job, and obviously it's a, well-paid job in Canada, which is above the average of the salary compared with the whole salary of the country. So I would say definitely it's a very well-paid job.
Excellent. Thank you very much. I really appreciate your time, Doc. I hope that this will give our students some motivation and some peace of mind to focus on what they need to do, which is their studies, and not being distracted by what they hear, or they really just need to focus on their studies. That's all that's important. We have provided all the tools for them. The rest is really up to them. We've done our part. The rest is up to our students.
And also the website of the CVMA Canadian Veterinary is really helpful. They give you all updated information. They don't need to worry. As soon as we check it, that's what we did. Exactly. We checked it and we registered and we step by step, but we didn't have the luxury of helping anybody. That's what you are doing. Definitely they're much more ahead of us than what we did. And they can be really easily successful. Yeah.
Excellent. Thank you very much for the interview, Doctor. We'll do a quick tour of your clinic after this video.
Sure, yeah, okay.
Thank you so much.
Have a good day.
I just sent the blood work.